infected with COVID-19. More than 80% of pregnant women remain asymptomatic and recover uneventfully, and it does not affect the baby. So please stay calm. Even if you are affected with COVID-19, nothing to worry. You only need to contact your doctor and follow the protocol management. As of now in India, I think maybe in a short while from now, we should be getting the guidelines from the VACCINATION. The National Committee is working on it, trying to justify the use of the COVID-19 vaccine in pregnancy. So far, the trials conducted have not shown any adverse effects. So ideal situations would be that we have large randomized controlled trials wherein the vaccine has been administered to pregnant women and the effects documented. But because this does not allow that, and we are seeing that the side effects of after getting COVID-19 are more than not taking the vaccine, I think vaccination is going to be shortly made possible for pregnant women as well. Whereas for lactating women, we have already rolled out the vaccine. There is no contraindication for women who are feeding the babies. Pregnant women, the government directive will come shortly. Yes, certain studies have shown that prematurity is a complication of COVID-19. So, as I said, more than 80 to 90% of the population of pregnant women who are affected with COVID-19 remain asymptomatic. Pregnancy continues uneventfully, and there is no side effects documented on the baby. But if the pregnant woman, that is in the last few months of pregnancy, say around the 7th, 8th, 9th month of pregnancy, are affected with COVID-19, we have seen that probably because of the physiological state of the already existing pregnancy, the complications are slightly higher, requiring more hospital admissions, ICU cares, and the extra supportive therapies. Some of the premature births may be, a medical decision so that the woman also improves and the baby doesn't have to suffer inside the womb with hypoxia. So that may be the main reason of prematurity. That is what has been shown to cause prematurity and cesarean sections in COVID positive women. Again, so as soon as we deliver the baby, we do the COVID test for the baby. In most circumstances, babies do not test positive for COVID-19. And in the few cases wherein the babies have tested positive, also the babies do well. They don't require any treatment. We have seen that they do well. Yeah, so that fear need not be there in our minds. And once the mother is positive, we do encourage breastfeeding even after birth, even if the baby is negative. But the only thing that we tell the mother is to wear a N95 mask and then feed the baby and keep the baby at a distance. It may not be like, we may not be able to make the baby lie down next to the mother. So we will require a caretaker who will take care of the baby, say the patient's mother or anybody who is there to help out will be taking care of the baby, but feeding would continue. In pregnancy, we have seen that most of the COVID-19 presentations do follow the usual symptoms. There is no unusual symptoms. So most of them are presenting with cough and fever. So in this age of the COVID-19, unless otherwise proved any fever, we do consider it to be COVID-19. But again, that does not mean that, one spike of fever, you require to panic. Stay calm, contact your healthcare professional, take a dolo, wait and watch. If it doesn't go down, or if you have other family members showing symptoms, then please go ahead and do the test. Don't delay the test fearing the result. Like most people do not do the test saying that, oh, what if it comes positive? Then I'm going to be, I'm going to land myself in problems. Please Remember that doing the test and finding out you're positive always avoids problems because you are under the right path. You are able to contact the health professional, take adequate care to avoid problems. So do the test even if you think there is the slightest possibility that you could be affected with COVID-19 because that helps you and your baby and your family members. But at the same time, please do not panic. Please try and take the correct advice from the correct people. Do not believe in random forwards of WhatsApp or Google.